In this video we are going to talk about an anti-diabetic drug called Pioglitazone, which belongs to a class of medications called Thiazolidinediones. What it is the mode of action of Pioglitazone. Pioglitazone reduces peripheral insulin resistance, leading to a reduction of blood glucose concentration. Indications and dose in type 2 diabetes mellitus, alone or combined with metformin or a sulfonylurea, or with both, or with insulin. In adults, start initially with 15 to 30 mg once daily, adjusted according to response to 45 mg once daily. In elderly patients, initiate with lowest possible dose, and increase gradually. Review treatment after 3 to 6 months and regularly thereafter. What are the side effects of Pioglitazone? Common or very common side effects include: Pioglitazone increases risk of bone fracture because of increased bone marrow adiposity, decreased osteoblast activity, or reduced aromatase activity leading to altered estrogen production, and increased bone resorption. Long-term use of thiazolidinediones increases risk of infections like these are associated with risk of pneumonia or lower respiratory tract infection. Numbness occurs and chances of weight increases with this drug. Pioglitazone also causes vision impairment. Pioglitazone may increase the risk of bladder cancer, so patients with long-term and high-dose exposure to pioglitazone should be monitored regularly for signs of bladder cancer. This drug also causes insomnia, which is a common sleep disorder that can make it hard to fall asleep, hard to stay asleep, or cause you to wake up too early and not be able to get back to sleep. Incidence of heart failure is increased when pioglitazone is combined with insulin, especially in patients with predisposing factors, e.g., previous myocardial infarction. Rare reports of liver dysfunction are reported, so discontinue if jaundice occurs. Pioglitazone with metformin when combined in dosage form, then in adults, 1 tablet twice daily. Titration with the individual components, pioglitazone and metformin, desirable before initiation. Avoid pioglitazone in pregnancy and breastfeeding. This was all about today's topic. To stay up to date, make sure to subscribe to our channel. Thank you.